First of all, what is a stroke?
A stroke can be of two types. A blood vessel that takes blood up and oxygen to the brain can either be blocked, so that part of the brain can't get oxygen. That's what we call an ischemic stroke. Or it can be ruptured and bleeding, and that's what we call a hemorrhagic stroke.
So we've got an ischemic and a hemorrhagic. Are they easy to differentiate?
They're very easy to differentiate. A basic CAT scan in any emergency room will tell the doctor quickly if it's ischemic or hemorrhagic.
And what are the symptoms? Are there any keys to, I think I'm having a stroke, or I think my neighbor's having a stroke? What are some of the symptoms?
We talk about FAST as a mnemonic to remember. So FAST, if you see someone who has facial weakness, weakness in one arm, or if they have problems with their speech, face, arm, speech, time is brain. So the T is time. Call 911 as soon as you see any of those symptoms so that we can quickly react to that.
So what does the face look like? If somebody has a stroke, what happens with the face?
Typically you'll see asymmetry or weakness on one side. That's the most common thing.
Is it usually the one side of the mouth will droop or the other when you smile? So you tell somebody to smile, let me see your teeth, and one side will droop.
Correct, or open your eyes and you can't open one eye as well, correct.
How about the weakness in the arm? How weak does that get?
It can be anything from completely unable to move that arm, or if you ask them to hold up their arms, they can't move it, or it may be something where they can only get it partially up. It may be partially
It must be interesting to see the different variants on that. In speech, what's it sound like?
We see two different things, typically slurring of the words, where these words are all slurred and they're hard to understand, but they're the right words. And another word we call is called aphasia, which means they can't say the right words. So the words make sense, but they don't go together and they're not the right words.
So if you see those symptoms, you call 911?
Call 911.
Get to the emergency room right away. Does the ambulance or the emergency medical transportation, can they do anything on the way to the hospital to help the doctor?
They can determine if it's what we call a large vessel stroke or a bad stroke. And if they see in the field it's a bad stroke, they will take the patient directly to a comprehensive stroke center. And that's kind of a big fancy word for a hospital that does all the things that neuro-interventionalists do.
Neuro-interventionalists, and we're going to get into that in just a minute. So when somebody gets to the hospital, is there anything you have to do to make the diagnosis? Yep, this is a stroke.
We do that CT we just talked about to see if there's any bleeding. Is it a hemorrhagic or an ischemic stroke? Because those are treated very differently. And if we don't see any bleeding, we do what's called a CTA, CT angiography. And we do it right after the CT, and it shows us the blood flow to the brain. And is there a blockage? We can see that blockage.
Does it give you any other information, a CTA, the CT angiography, the blood vessel, the CAT scan of the blood vessel? Give you any other information about how much of the brain is involved, or how old the clot is, or anything like that?
It does. So the perfusion shows not only what part of the brain is not getting enough oxygen, but it can also estimate how much of the brain is permanently damaged versus how much is treatable or salvageable. And that's what I want to see. I want to see somebody who comes in who the brain's not getting enough oxygen, but it's all still alive. So if I go in there and open that up, they'll get much, much better.
So if you go in there and open it up, what you're going to do then is allow the blood to begin to flow again.
That's right.
And so the brain begins to get the oxygen that it needs. And the brain uses more oxygen than most of the body.
Any other part of the body, that's right.